You're live.
Hey guys, it's Dr. Emer. We're now doing a little subcision to some of her superficial scars. This is where we take either a cannula or something called a no-pore needle. This is going to burn a little bit to her because this is numbing medicine going in. You guys can see it's blowing up right here. This is to protect her skin. What we're doing is using a long cannula with some numbing medicine to just kind of fill up the upper cheek area with fluid. And then this fluid is going to allow me to literally release this skin from below so that I can lift up any scars that she has. Most of her scars are really on her upper cheek area. So she shouldn't really be feeling too much, but I'm going to put
Is
this
this
here.
good for cellulite?
You can do this actually for cellulite. Yeah, you can. Okay, so you put your head straight on the shoulder so you guys take a look. This is all numbing that's in here and all fluid. We're going to let that sit a second. Melissa, will you hold here a sec? I'm going to let that sit and kind of marinate. Not in a bad way, in a good way, because she's going to get numb then. Hold on. And then we're going to go to the other side now. Turn your head all the way to perfect. And again, same thing, a little bit more, a little bit more. There you go. Same thing, little pinch. You're doing great. Go ahead and take care, perfect. So now we're going to go in there and, again, superficially right up on the skin. She might feel a little bit right now, but we're going to put in some numbing medicine. Here we go. Again, just want that fluid to kind of build up. Not only will it help us do the subcision better, but it's also going to help her with the laser so she doesn't have much pain. Okay. Perfect. So we're going to leave that there. And come back. Grab me one more. Perfect. Again, one more numbing. I'm going to go again to a little bit more on the middle part of her face. She's doing great. And again, this fluid lifts the skin up so that it's not attaching. It's between any of those scars. We can break them apart. Okay. Great. So now again, let me put her head straight. Go ahead and put your head straight. See how this is now calming down a little bit, but this is still really hard. The fluid's absorbing. So let me switch sides. I'm going to come back. Sorry, Will. Turn you to the left. Like she's fine. Now she shouldn't feel a single thing. She'll just feel like a chipmunk. That's all.
Does tethering happen when you pick your scars?
It can significantly, actually, yes. So here I am right now, you guys. I'm doing the subcision. Are you feeling anything?
No.
Good. I just want to make sure she's safe and she's okay. So we're going, we're literally breaking the scars up from that central part of her face. Okay? And in the old days, you guys, we used to use a razor blade to do this called a no-pore needle. And about half the patients would get very big bruises. And those bruises, you guys, would be what went in between the scar and the skin so that it didn't keep the tethered scar, didn't tether back down. It allowed the scar to stay lifted. Nowadays, we do things like Sculptra and filler to fill that space. So what do we do today? A little Sculptra. So that Sculptra is already in there, and here we are now breaking apart that scar tissue. Okay, you can kind of hear it cracking a little bit. We're lifting the skin. That's it. She's doing great. Most of these scars, I don't even feel them anymore.
The white dots are TCA cross.
Yeah, the white's TCA. That was our first step. And she's going to get a little more swollen and bruised in the middle cheek for a week, but we're going to laser anyways, so it's a perfect time to do it. And again, you can see we're literally, you could hear it crackling a little bit. Hear it? Did you hear that?
Mm-hmm.
Okay. Good. Beautiful. Okay. So now, I'm going to turn to the right again.
Is this good for craters?
Let's switch with you again.
Oh.
Yes, it is. Turn to the right. Perfect. No more. Perfect. Okay. So again, we're gonna come right here, superficially, right up, and look at that, right at the edge. I tell people it looks like a fish swimming in water. We're just breaking it up. Look at breaking that scar tissue. I'm sure this looks brutal, but how are you feeling?
I can't feel it.
She can't feel it, so she's doing good. She's actually smiling, even though everyone thinks I'm torturing her right now on social. But I'm telling you, in the old days, you guys, when no one was teaching anybody, and I would do this off my phone, blood was going everywhere, hematomas, bruise, because we did the razor blade technique.
So they're asking, what needle do you use now instead of the razor blade?
Well, you know, Will, this is a cannula. Okay, you guys take a look. This is actually blunt. I can push on the skin and it doesn't cut through because it's not sharp, but it's letting me break the tissue up softly and gently so she doesn't get as much bruising. And then that lifts the tissue. Now the problem is, how do you keep the skin lifted? You have to put a filler in there. So we use the little Sculptra today. That's gonna build over time.
Lady AKP says, sending love to all my friends at the office.
We love her. That's a patient of mine who just did this, basically, on live. That's the funny part. And her neck lipo. So she's apparently watching and seeing what we're doing now. Look at this, moves freely through, you guys, freely, look, perfect. No more scars, freely, look, right through. Literally just back and forth, without any resistance, which means that's great. All the scars have been lifted.
Yes, she's numb.
Of course, I'm not gonna torture her, you guys, come on. You guys think I am?
Love from Italy, Dr. Jason, number one.
I did 2 consults in Italy today, love you guys. Okay, perfect. And that's it. That's the subcision, you guys. So now we're going to get into laser. We'll do a little more numbing. We'll be back when we do that. Perfect. Okay, so let's do some nerve blocks.